Are you looking to apply to schools with BSMD programs? We wanted to let you know that you can calculate your chances of admission at schools that offer BSMD opportunities with your free CollegeVine account. Start by completing your chancing profile with information such as your GPA, test scores, and extracurricular activities. From there, you can use CollegeVine's Hub tool to see your chances and information about different schools, such as cost, majors, and more. Visit the link in the description below to sign up and see your chances today.
So I've thrown the term PreMed around. Let's talk about what PreMed means. So, well, let's talk about BSMD first. It's on the left side. BSMD is a medical school admissions with an undergraduate degree. There's a conditional guaranteed acceptance to medical school, and it's contingent upon maintaining a certain GPA, achieving a certain MCAT score. So in my case at BU, I can't speak for all schools, BU I had to maintain a 3.2 GPA and achieve at least an 80th percentile on the MCAT, right? So for me, it was kind of a breeze. Getting those grades wasn't as hard. Achieving highly on the MCAT, sure, it was doable. However, other schools, such as WashU or Northwestern, they have 3.9 or 3.8 GPA expectations. So students in the program have to maintain at least a 3.8 or 3.9, whatever that number is. Their MCAT score, something like the same. Other schools, you might not have to take the MCAT in the first place, right? So every school varies, but there's always going to be some kind of condition that you have to meet while in undergraduate years. For BSMD, there's possibly an accelerated route. Again, it could be a 6-year, it could be a 7-year program, rather than a standard 8-year or 9-year kind of take to eventually get to medical school. You oftentimes might also have a non-negotiable undergraduate major. So in my case, I had to major in medical sciences, but caveat of BDU, I could apply, I could minor in something that was outside the natural sciences. So it's very interesting to me. Another thing about BSMD programs, you might be under one school system for years. We talked about that a little. And you might have limited summer internships and research opportunities, really just because during summer years, if you're in an accelerated program, you have to take summer courses. So I had to spend one summer at BU taking my summer courses, but of course I took some time to do research during that summer, so it was kind of interesting to me. But there might be some time restrictions, especially on calendar years, if you're under an accelerated program. PreMed, on the other hand, is a designated undergraduate route for medically interested students. So if you're majoring in, say, biology or chemistry or something that's similar, you're going to take a lot of pre-med courses. So you're going to take medical school prerequisites, so things like physics class, chemistry class, biology, and to fulfill major requirements before you can even apply to medical school. These are mandatory courses that every medical school applicant has to take in order to even apply to medical school. Applying to medical school, you're going to need a lot higher GPAs, a lot higher MCAT scores to be a competitive applicant. You have a choice of a gap year, however. So between undergraduate and medical school, a lot of students end up taking a gap year. So spend a year or two conducting research or working in industry or fulfilling other coursework they might not have in their application. You also might have a flexible undergraduate major. So you can minor something that's not as stringent. And you have summer internships and research opportunities that you might not have in accelerated programs. The choice between BSMD programs and PreMed is not an easy decision, but here are some things to consider. Are you 100% committed to go into medicine? And that's really, really crucial. As a high schooler, are you able to answer that question to the best of your ability? Do you have the background and the exposure to really be sure that you want to go into medicine? Because once you submit and say that you want to go into medicine, it's hard to back out. It's hard to kind of be mature enough and say, hey, medicine's not right for me, right? Also, are you willing to attend a less prestigious undergraduate program? That's a really big thing too. A lot of BSMD applicants are super competitive as high school students. They have high GPAs, high standardized test scores, really strong research extracurriculars. To Ivy Leagues, Stanford, MIT, Caltech, those are very attractive things to those universities, right? So it might be easier for you as a student getting in, as a high school student getting into those schools. But for a BSMD program, oftentimes it's a lot harder. The expectations for students are a lot harder, even if you have those stellar GPA and standardized test scores. Also, you want to consider, would you rather have more time to explore before committing to medical school? Are you willing to work hard to maintain the spot in the BSMD program? I'm kind of understating the rigor of these programs. The expectations, the classwork is a lot of work. So you have to be ready as a high school student to take on those challenges. Do you meet the application criteria for being a competitive BSMD applicant? We'll break that down in a bit. How much of the college admissions process can you commit to BSMD applications? That's another big thing. When applying to colleges, you can apply for the normal undergraduate route and the BSMD route, right? Those are two separate paths, right? But note that BSMD applications are very intensive. You not only have to write an application for the undergraduate school, you also have to write an application for the medical school as well. So you're almost doubling your work for one school that you're applying to, right? So oftentimes BSMD applications and applicants will have a lot of work. In effect, you're doubling the amount of application coursework. So you just want to be very efficient with your time and know what you're getting into beforehand. If you're going to compare MD versus DO degrees, this is another kind of term I threw out, this doctor of osteopathic medicine, right? So MD is a school of admissions for doctor of allopathic medicine. And allopathy is considered the traditional medicine, the normalized medicine. But of course, that's kind of just a term that is more common, not to say it's traditionally practiced. That's how I would phrase it. Allopathic medicine has a traditional reliance on pharmaceutical and surgical interventions and therapies, but there's recent shifts to preventative medicine nowadays. It's not always about the interventions, it's about establishing preventative care to make sure that patients don't actually have to go under the knife or have to take drugs in the first place. To get licensed, you have to take the USMLE exams. And historically, there's more chances to specialize with an MD degree. So if you want to be a surgeon or you want to be a very specialized type of doctor, oftentimes those people come from MD granting schools, historically. DO programs are a little different. So this is a school of admissions for doctor of osteopathic medicine. Excuse me. School of admissions for doctor of osteopathic medicine. Osteopathy treats not just specific symptoms, but the body as a whole, and added more hands-on approach to diagnosis. So this is more of the preventative side of medicine, or naturalistic side of medicine. And in fact, I'm kind of on that side, right? I would rather have patients try more natural therapies, preventative therapies, rather than pharmaceutical and surgical therapies that might be more cost intensive. Right? DO can also often focus on more holistic and alternative therapies, and you are going to have to take the complex exam or the USMLE to be licensed. The choice between MD and DO is also not a easy choice to make. So here's some things to consider. How do you see yourself practicing medicine in the future? So again, like I mentioned, there's some downstream career impacts depending on which type of schooling you want to go to. Are you aware of the potential career impacts? DO offers less chance at obtaining competitive residency spots unless you have a very high USMLE score. There is a perceptual difference between MD, more prestigious, and DO, less prestigious. And are you aware that there might be a difference in the education of BSMD and BSDO programs? So it's hard to imagine a high school like super hard to know what you want to do in medicine 9 years, 10 years down the line. But you might want to anticipate that and hopefully predict what you want to do when first thinking about the program you're entering. Okay, so let me take a break there before we go into recent trends. I do see a lot of questions. I'll start kind of breaking down some of those questions because they're kind of relevant to what I've been talking about. Before we do, at 7 p.m. today, we have a How to Build Your College List event. So if you're looking to actually construct your college list for the first time, or maybe you have a college list, you just don't know if it's balanced enough, we'll break down how to approach those problems and find solutions for you in this live stream. Great, so let's get to some questions. All right. Rose asks, do all universities with medical school have early assurance programs? No. So not all universities that have medical schools have guaranteed medical programs, or early assurance programs. It really varies. You can get a better sense of that list through the presentation that I gave, or that I'm giving, and you can also check on the College of Mine blogs as well. We have a couple blogs on BSMD guidance. Early assurance programs, not so much, because our focus is more on high school students getting to college, not college students applying to medical school. All right, Servesh says, in an early assurance program, would you have to take 4 years after deciding in undergrad, aka 6 years in undergrad, or does it take the same amount of time overall? Yeah, great question. It takes the same amount of time overall. So as a second year in undergrad, I commit to medical school, and I just finish my junior and senior year as if normal, and then I matriculate to medical school. It's not 6 years. Really good clarifying question though. Essentially, you're just a normal student. You just decide to commit to medical school, and you continue down the same trajectory that you were. Yeah, another question is it guaranteed acceptance to medical school? No MCAT needed. Depends on the program. Some programs require a minimum MCAT score, others don't. Deborah asks, is there a discount for BSMD students? In terms of tuition, oftentimes no. So that's kind of a disappointing fact. BSMD admissions itself is competitive, and schools in some way are doing you a favor. That's the way they phrase it, that they're allowing us into their medical school as high school students, right? So oftentimes they don't even give any merit aid. Other times, if you're part of an honors college and part of the BSMD school program, you could end up getting financial aid. It really varies, but for the most part, because of the program, you won't get much aid. All right, Deborah asked a great question. How can you maintain a BSMD workload and a social life? I would argue that BSMD workload is kind of just like, especially in undergrad, it's just being an undergraduate student with intensive classes. I wouldn't say it's like the worst thing in the world, but when trying to maintain a GPA, it can be stressful at times. So this is just a general question for how does a busy college student balance their social life? And it kind of comes down to multiple things, like maintaining a good sleep schedule, having healthy study habits, making sure you eat enough, making sure you take time for yourself and for your friends. It's just kind of like those common things, but I wouldn't say it's like starkly different from a competitive, typical undergraduate major. All right, so there are other questions there. Let me answer 2 more. If I don't get your question, feel free to ask it again, but I think I'm kind of covering it. Okay, Michelle asked, can you please show the second less selective slide? Yeah, let me put that up real quick. Okay, so Michelle, this is for you. And then Lisa says, I can't get to the video to watch, please help. Yeah, so sometimes these live streams run better on Google Chrome, if you want to try that. And another way is just try refreshing the page. Those are the 2 best things I can give you. If you're working on a Mac, you can close out, if you're using Safari, close out of Safari, quit, like literally quit the icon, and then open it back up. If that doesn't work, try deleting cookies. So if one of those 4 options doesn't work, try a third browser. That's really it. But don't worry, if you're kind of missing, I don't even know Lisa's here anymore. But yeah, if the live stream's not working, if the video's not working, this will be recorded anyway. You can always refer back to it. Okay, really great questions. I see more questions on there, but I'm gonna skip ahead. I'll get back to the other questions. Some recent trends in the BSMD programs are there's a lot more applicants applying today. So because there's more applicants, there's increasing competition in medical school acceptance. This doesn't just apply for BSMD programs, it applies even for medical school itself. A lot of people want to become doctors now, and because there's so much more demand for becoming a doctor, the competitiveness increases. And it's also true that guaranteed programs does not equal easier. And I already mentioned this before. There's a lot of academic stresses and requirements that have to be met. There's also a lot of higher achieving students applying to these programs. There's higher academic and extracurricular requirements, and more need for medical specific focuses, especially for these programs. So when you, as an applicant, you want to make sure that your high school profile has a lot of medically related activities in it to convince admissions readers that you want to enter medicine for pure reasons and that medicine is your passion indeed. Like I mentioned UMiami before, there's actually less BSMD programs than there were 5 years ago. There's been a recent drop in offered programs due to various factors. And again, because there's more drop, there's more competition.